Good afternoon and welcome to this CAFE webinar on mental health issues and challenges in the workplace, at home, and in society, coping with the persistent pandemic's impact. We are delighted to be joined today by three leading Canadian experts in this area of wellness in the workplace and society. First, Paula Allen, global leader in SVP, Research and Total Wellbeing, LifeWorks, the successor to the business formerly known as Morneau Sobico. Next, Irene Keller, Director, Group Benefits Products and Solutions, Sun Life. Rounding out our esteemed panel is Shauna Oliver, AVP, Head of Global Benefits, Manulife, working out of its Boston office. Paula Allen is the Global Leader, Research and Total Wellbeing, and a Senior Vice President at LifeWorks. In this role, she manages the research agenda for LifeWorks, which includes primary research, exploratory data science, research collaborations, and meta-analyses. Her focus is on discovering, defining, and communicating industry trends, service developments that aligns with emerging market needs, and supporting LifeWorks clients with insights and data-driven decision guidance. Paula is a well-recognized expert in all areas of workplace mental health, learning strategies, disability management, and drug plan management. Paula is a member of the Women's College Hospital's Board of Directors, on the Board of Directors of the Canadian Club of Toronto, a member of the One Mind at Work Guiding Council, and is on the Technical Committee for the National Standard for Psychological Health and Safety in the Workplace, among many other engagements. Paula completed undergraduate and graduate degrees at the University of Toronto in psychological research and neuropsychological testing and clinical intervention. Irene Keller is a Director of Product and Solutions in Group Benefits at Sun Life Financial Canada. She is responsible for a team of product managers and for the identification, selection, implementation, and management of innovative insurance solutions, supporting key global benefits businesses, primarily for disability and mental health. Her main accountabilities involve growing the strategic vision and prioritization for the portfolio of products critical to global benefits' continued financial success, relationship management across key business stakeholders, as well as designing and implementing continuous improvements to the product development process. Irene's knowledge and expertise includes the strategic development and implementation of health products, organizational health strategies, and workplace mental health strategies. Irene is a registered nurse with the College of Nurses of Ontario and holds a specialized certificate as a Canadian Certified Occupational Health and Safety Nurse. Oliver prides herself in challenging the status quo and has spent 22 years in the healthcare industry doing just that. Over this time, she has worked with key stakeholders spanning the ecosystem as an underwriter, a consultant, within health technology, in operations, and currently at Manulife overseeing global benefits and wellness. Her breadth of experience uniquely positions her to push for evolution with confidence. Shauna is pursuing her doctorate of business administration at Drexel, holds an MBA from the University of Oregon, a BA from the University of Hartford in creative writing, and a BS in business administration from Purdue. Welcome, Paula, Irene, and Shauna. We're so delighted to have you with us today. My name is Keith Martin, and I am a co-executive director of the Canadian Association of Financial Institutions and Insurance, or CAFI. On behalf of myself and my co-executive director colleague, Brendan Wicks, and the CAFI Board of Directors, thank you so much for joining our webinar today. CAFI is a not-for-profit industry association dedicated to the development of an open and flexible insurance marketplace. Our 15 members include the insurance arms of Canada's major banks and credit unions, along with their industry business partners, which underwrite credit protection insurance and travel insurance. This is the second of 3 CAFI webinars that we'll be holding in the first half of 2022, all of which are focused primarily on issues related to life and health insurance policy and regulation in Canada. If you have any questions that you would like to pose to one or more of our 3 panelists during the Q&A session, for which we have allotted 20 minutes at the conclusion of today's webinar, please send them to me as your host using the Q&A function of Zoom, and I will pose them on your behalf. Unless you specifically request in your question that you wish to be identified as its source, I will pose all questions on an anonymous basis. I will also ask 3 poll questions today during the webinar on 3 topics, so more to come on that. And just before we get underway, I want to extend a special welcome to some VIP guest attendees. In addition to many representatives from our 15 CAFE member companies and from our 10 associates, which supply essential services to our association and its members, we also have attendees today from allied industry associations such as the Canadian Life and Health Insurance Association and the Travel Health Insurance Association, and from insurance and financial service regulators and policymakers from across Canada, including the following: the Alberta Insurance Council, the British Columbia Financial Services Authority, or BCFSA, the Financial and Consumer Services Commission of New Brunswick, the Government of Alberta, the Insurance Council of Manitoba, and the Insurance Councils of Saskatchewan. Welcome to you all. We'll now jump right into the webinar. Paula, Irene, Shauna, let's get started. My first question is, how has the pandemic changed or accelerated mental health issues and challenges in the workplace, at home, and in society generally? And what is the status of people's mental health now relative to before the pandemic? Paula, could I ask you to start us off?
Yeah, very, very happy to. And it's a question that's coming up a lot. And I think the reason why the question is coming up a lot is that we all intuitively know that there has been an impact. I think, though, that we might underestimate the extent of that impact. When we started this pandemic, so many things were introduced into our lives. There's change and uncertainty and risk and isolation. And these are all things that the human mind does not like. These are major stressors. We have a mental health index at LifeWorks, and we were tracking the mental health of working individuals prior to 2020. So we have a benchmark of 2017 to 19. And then we looked at it monthly starting in April of 2020, and we saw a massive decline. So from our pre-pandemic benchmark, we saw a decline of 12 points. And what that means is a massive decline, because even a 2-point decline on our scale, you start to see differences in people's behaviors and illness rates and everything that is visible. So when you see a decline of 12, it really explains some other data that we had, which is a tripling of risk in the working population. So, we were like 12 to 14%. Now we're 1 in 3 working Canadians considered high risk of mental health issues. We've seen the level of risky drinking in the working population go from 2% to 8% of the population. So without question, this whole asteroid that's entered into our lives has been very disruptive, and we will see the impact of it for quite some time, unless we're very intentional about making sure that we support our mental health more assertively than we have been.
For that, Paula. Irene, what are your thoughts on this question?
Yeah, I would agree with everything that Paula said. Mental health was an issue before the pandemic, a big issue before the pandemic. So the pandemic has only accelerated all of that. And we know that it's the leading cause of disability in Canada. And we expect it to become even more of a problem, especially in the younger population as well. So under age of 35, we're seeing a huge increase of claims from a younger generation coming in. And despite the progress that has been made, it's not that the progress hasn't been made. Despite it, though, there's still stigma that's associated with mental health, and we need to continue to work on that and have safer workplaces in order to really combat this problem.
I mean, just a quick follow-up. Why do you think it's especially young people that are being impacted?
That's a good question. I don't think anybody really knows exactly why, but I think that I think that the rate of change in the world, the rate of the social media, the use of social media, I think it has all contributed to this. But there's probably many thoughts, and Paula probably has more research on that. and getting to the root causes. But it is interesting that it's younger population. The hugest increase is from that population.
I jump to Shauna. Maybe Paula, you might comment on this issue.
I'll just build on what Irene said, and then definitely welcome Shauna's comments as well. So we're seeing the exact same thing, that the younger population, the younger individuals are really more impacted. And we have done a little bit of exploration, and we find a few things. One is that it's a vulnerable stage of life to begin with when you're actually going through life changes, and the younger the worker, the more vulnerable. So people very early in their career, like 20s, late 20s, the scores are lower than those who are in their early 30s, or lower than those who are in their 40s. And in that area of life where you're leaving home, you're establishing yourself, your new career, you need a lot of validation. It's stressful to begin with, and we've had a situation where all sorts of things have taken people's minds away from validation. And also, when you're in a situation where you might not be physically with your coworkers, it's not as easy to kind of understand whether you're on the right track. More importantly, though, it's a time of life where you really need your social circle. And the isolation that has actually been tipped off and become worse as a result of the pandemic is really impacted people. Well before the pandemic hit, we found that the society was slipping into a higher state of isolation. We've seen comments from Surgeon General in the US. We see, Japan and UK have political figures actually tackling the issue of isolation because it is such a public health issue. And this pandemic exacerbated that. So when you don't have your social supports, when you don't have your structures around validation, when it is a high risk period in life. And then the only last thing that from our data I'll share is that we also find that financial vulnerability has been adding to people's stresses as well, particularly early in the pandemic, when people didn't have emergency savings. That really kind of knocked you off balance because there was a lot of unknowns. So that's mitigated a bit since early pandemic, but it certainly showed its mark when we did do that analysis.
Thank you for that. And Shauna, we'd love to hear your insights and thoughts on this question.
Yeah, thanks, Keith. I think, another perspective that I would bring is, and I agree with definitely both Paula and Irene, is that in addition to the awareness that we have that mental health was an issue going into the pandemic, we've obviously seen utilization increase for services, whether it is mental health counseling, whether it's people going out on disability. We've seen an increase in benefits like pharmacogenomics, of people really trying to find the right mental health prescription use at the right time. We're also very well aware that there's going to be a mental health wave as the pandemic eases up, and that a lot of people are still kind of in this fight or flight, helping their families towards things. And as we get back into some form of normalcy and people start to take a breath, we're worried that there's going to be kind of that realization that we have just now gone through over 2 years of an extraordinarily stressful time, and there will need to be support. I'm particularly cautious for our working mothers who have supported a lot through this time, that we want to make sure that there's benefits in place and needs for that. So fully agree, and we still have a far way to come. And I think that's why sessions like this are so critical. And it's really important for employers and insurance companies and in benefits offerings to really take a stand and make sure we help our families that we care for to make sure that they have what they need in place.
Interesting, Shauna. I remember in university when it was exam period, very stressful period, I would get through it. And then after the exams are all done, I would often get sick. And it's like, it's got to come out at some point, but it can't, it's not necessarily when you're actually experiencing the stress, because maybe you just have to get through it. Is it something like that is of concern, that it's like people are sort of building up all this stress and it's got to come out at some point?
Yeah, I mean, I definitely, I'm not the clinician here by any stretch of the imagination, but I would say, in a very simplified way, yes, right? So for 2 years, we've been dealing, we've been working, we've been having forced to adjust to new ways of working, and new ways of life, and pivoting to support, whether it's our children, whether it's our parents, everybody has been adjusting to new things. And at some point, we are going to have an ease and take a breath, and take a moment to realize everything that we've been through. And so, it's at that point that several may have been blocking everything, or blocking what we've processed. And so I think there is definitely risk there, that, a lot of mental health support will be needed for people who have yet to process everything that has happened.
Thank you, Shauna. I'm going to launch our first poll now. And the question is, do you know someone within your immediate or extended family, or within your circle of friends and acquaintances, who has experienced a mental health issue or challenge at some point in their life? It's a yes, no question. I've just launched it. Please offer an answer, all anonymous, all aggregated. No one will be identified. Please let us know your answers. Just wait a few more moments for people to answer the question. Okay, so we have a good sample of our audience, and quite a result, 100%. Does that surprise you, Shauna?
No, it doesn't. It doesn't surprise me at all. I think, again, it's been such a long couple. It's been a long road, and it's been a long couple of years, and we've seen, personal events. We've seen people getting sick with COVID. We've seen untimely deaths of loved ones. We've seen world events happen. We've seen isolation. So, we've seen people who have been at home and maybe, become obsessed with working out, or become obsessed with food counting, or have put on weight. There's been so many things that we've been kind of forced into households in these four walls that we've never had to have happen before. So it's not surprising to me at all. I myself, started counseling right at the beginning of the pandemic, and as did my family shortly thereafter.
Thank you, Shauna. Irene, Paula, are you surprised by this?
No.
I would have been shocked if it was anything else.
Yeah, exactly. Same thing. I would have been shocked if it were any lower than that. Yeah.
Thank you. I'm going to, given this reality that this is a situation that nearly everyone faces, ask you the next question, which is, please tell us what are the critical organizational policies, procedures, and supports that need to be in place to support employees who are facing mental health issues in terms of benefit plan coverages, but also importantly, in terms of workplace culture. Irene, do you want to start us off on that one?
Yeah, sure. So, we believe employers have the ability, the opportunity, and more importantly, the responsibility to really make a difference in this national issue. Employers need to be helping their employees by normalizing mental health in the workplace and creating that safe, supportive environment, and fostering positive dialogue and offering tools and resources so that people use them. The cost of absence and presenteeism to a business basically requires the employer to have a leading role, and they simply can't afford not to do it anymore. Now more than ever, managers also have an important role to play in supporting mental health and well-being of their teams. And so, really, culture of the workplace is really the bedrock to any mental health strategy. It sets the tone for the organization. And without that supportive culture, the efforts are likely to fall short. So you can have all the tools and resources available, but if the workplace culture is not a safe one, you're really not going to make that impact. The national standard of Canada for psychological health and safety, they've identified those 13 factors that influence mental health in the workplace. And they include the ways employees work, their work environment, and it can involve things like deadlines, workloads, work methods, And it can also involve relationships and how employees react with their managers, their coworkers, and even their clients. So it really starts with people leaders. Managers need to know how to support their teams, but they also managers need to be supported by their senior leadership as well. So, it's really about having the right tools and resources, but and manager mental health training, but a supportive workplace environment is key.
Irene, I know, Shauna, you also think about this a lot. Could you share your thoughts?
Yeah, so I think I 100% agree with Irene that culture and cultural support is a must. What I found really interesting several years ago when we were going through an exercise where we were revisiting some of our values as an organization and allowed our employees to vote on what some of those values should be. One of the ones that emerged was share your humanity. And what an interesting reflection that globally our employees wanted that as one of our core values as a company. And what that says to me very loudly is that our employees want to be able to bring their authentic selves. And that means when they might not be fully present or maybe struggling with something, they want to be able to talk about it. And we've really embraced that as an organization and have put many things in place to support our employees to do so, to allow our leaders to share when they might be having moments and struggling with mental health themselves. We very frequently bring in leaders in the industry, whether it's psychologists or doctors, to talk about how even they themselves throughout the pandemic have struggled with issues. So I think, starting with the top and just recognizing it, I myself talk to my staff about what I talk to my therapist about and tips and tricks I learned. So the best way to really destigmatize is just own it and start having those conversations. The second thing I'll add, which I think is just as important, is I would encourage, and whether it's taken as a challenge or an invite, I will accept either. Employees should not have to choose between physical or mental health, period. And it's we worked very hard in our Canadian plan design to take that choice out of the equation. And so I would encourage all of my fellow employers or those on this phone call or webinar who work with employers to really work with your clients or work directly to remove that out of the equation. There should never be a choice. Physical health and mental health are equally important. And all employer plan designs should be put in place that a choice doesn't have to be made. Everybody should get the ability to have mental health support. It should come in a variety of ways, not one size fits all. There should be many different ways to access the health system. But the days we're saying you have to choose between one and the other are no longer valid. It was never a good choice to begin with. It shouldn't have been there, but that time is over. And I challenge or invite or encourage everyone to take a stand and say no more.
Thank you very much for that, Shauna. Paula, let's finish with this question with your thoughts.
Yeah, so I, again, very much agree with what's said, and maybe I'll just put a box around some points. I do think that the first thing is making sure, well, one of the first things is making sure that support is available. And Shauna mentioned, a plan design that takes the choice out of selecting and using your benefits for mental or physical health, absolutely. And also a continuum of care. People have different issues. Everybody has a different type and level of need. So support that helps you when you're in a crisis situation, supports that helps you in a long-term situation if you need ongoing care, at your work stress or a parenting challenge, or even building resilience, investing in our mental health the same way that we've come to realize that we have to invest in our physical health. We can't just assume it's going to be okay and then fix things at the back end. So that continuum of support is important. The second thing is that even if you have that, it doesn't mean that people are going to avail themselves of it. You have to make sure that you do have a culture where the self-care around mental health is not stigmatized, that people have the training and the skills and the knowledge around how to step in if they see a coworker or an employee struggling, because your environment, this is a team sport, mental health, that, sometimes you're not in a place where you can see what's happening with yourself, but the encouragement in the right way from someone else, basic information around mental health and self-care and what mental health looks like. One of the most disappointing things that we still hear is people saying that they have to wait until it's bad enough. I don't know when I should get some support. Maybe it doesn't feel bad enough just yet. And that says that we still have a long way to go just with stigma and basic facts. I don't think anyone, or I hope nobody, would say, I'll just wait till my cancer is at stage 4 before I actually get help. It defies logic. And the same thing with mental health. It will just make things worse, more complicated, and you're losing your quality of life in the interim. And the third thing that I would say from a workplace point of view is you have the services, you have the training and the environment to help people understand, what they should avail themselves of, but your culture itself actually impacts people's mental health. And this was mentioned in particular by Irene. If you're in a place where you don't feel psychologically safe, where Shauna mentioned you can't be yourself, you don't feel a sense of belonging, you don't feel appreciated, think about that in any sphere of your life, and that's not psychologically healthy. And that we know that the workplace can be helpful to people's mental health, but also it can hinder mental health. So it's really incumbent upon employers to understand how their culture and their norms and their leadership can be helpful to mental health.
Paula, let me actually dig into this in a little bit more depth. Start with you, Shauna. And the question is, what changes has the rise in employee mental health issues and challenges brought about in terms of the factors and approaches that are necessary for success as a manager, for employee retention, and the overall success of a business? So really building on some of your observations, Shauna, how would you respond to that question?
Yeah, thanks, Keith. So I would say first, particularly in this, so I think it's couple-fold, right? So it's really what, are there various benefits or kind of ways that you can help the employee, and then is there more philosophically some changes that can happen. And so I would answer your question in 2 ways. The first being that, I think it's key that we all understand that every employee is going to, a lot of employees are going to want to seek help in different ways. So what might be a right approach for one might not be right for another. And so some might see something like an employee family assistance program and think that's a perfect option. Some might see something like, I want to be in person. Some might see assistance through a virtual option. So, I think we need to be aware that in an era where preferences and utilization preferences of our employee base vary very drastically when it comes to support for our employees through things, whether it's mental health or even, beyond that, in any kind of what might be traditionally physical health setting, it's really important to offer options in different ways that they can access the care environment. I think when it comes to just how can businesses be successful in this environment and really help with retention, one, I think it is, we've historically heard about this concept of work-life balance and making sure people have work-life balance. And that always reminds me of, I always get this image of kind of the old manufacturing kind of hourly punch-in cards where you would punch in kind of work and punch out. And that was like, you created these 2 separate times of working. But the reality is that even then, the 2 weren't separate, right? You would always have somebody in the workplace that was potentially thinking about maybe a loved one who was ill or a stressful financial situation, and at home was maybe thinking about something that happened on the work line. And so I've always kind of questioned, does work-life balance as a concept even exist? And we're really in a place of what I would call work-life fluidity, where one really needs to envelop the other, and we need to be able to embrace the fact that to have happy, in my mind, happy and productive employees and employees that are willing to stay, we need to embrace the fact that we are human. And in that means work is part of that and family is a part of that. And sometimes they integrate and it needs to be fluid. So we need to, as we return to work, keep this concept of sometimes the best thing for an employee might need to step away for an hour to take care of that loved one, go to this appointment, and go do what you need to and come back and come back when you feel ready, and not, it might not be track your exact hour here or punch out exactly there. Like let's think of everyone as whole and really think about this concept fluidly to try to make life and work become more cohesive.
Very much. Irene, do you want to jump in on this?
Yeah, so I'll probably hone in on the same things that I saw in the last question, really, but I'm going to add some, just to further the point, add some stats that we had from a Sun Life survey. We have to remember that, again, mental health is still not always a safe topic at the workplace, and trust in employers is really the main reason. In our survey, we found that like 62% of the workforce said that emotional, mental, and physical fatigue was the top issue affecting them. But a third of the Canadians, said that they would feel unsafe to talk about it at the workplace. So going with what Shauna was saying, lack of trust in their employer is the top reason. They're embarrassed. Still, that is a big top reason, and fear of discrimination or affecting their career is the reasons why they won't do it. So, really, it's about creating that workplace culture, managers being trained and normalizing mental health challenges and show support and be honest about their own mental health struggles. Not everyone has experienced a mental health issue, but certainly they'll know somebody. And we saw that in the poll we just did, that everyone 100% said they themselves or knew somebody. So really, managers can work towards building a positive mental health culture for their teams. And I would say that really focusing on that culture and taking away that stigma and allowing for self-care is the main thing.
Sorry, and Paula, offer us your thoughts on this.
Right. It's hard to build on what Irene and Shauna said, so maybe I'll take a little bit of a different angle to it. And when you look at business success, really what makes the difference now and for the foreseeable future, it really is your people. Like, I know that we've been saying that for a while, but the technology is available to everyone. Like the supply chain, you can manage that. But it's the innovation that people bring to workplace challenges. It's customer service at every single level in your organization. It's the collaboration and creativity, and I think we take things for granted as human beings, and until something makes us not take them for granted. For years, we took our environment for granted, and we can't anymore. It's really kind of hitting us hard. So there's a lot of focus on environmental sustainability. For years, we took mental health for granted. We just expected, people to be a certain way, and if not, you were one of a minority and go fix yourself. That's sort of not, that doesn't fly any longer. So when you're talking about sustainability of human being, thought processes, innovation, all of that wraps up into how you support the full continuum of mental health. So it makes sense from a business point of view. And I think the pandemic is the thing that has hit us to make us realize that we can't just be passive about it. It's not just about doing the minimum and getting away with it. It's about investing in your people and their mental well-being so your business can survive in this new era of innovation, creativity, and problem solving.
Thanks, Paula. And that's a perfect segue to a question we've received from the audience. It's one I'll pose to all three of you, and it's a bit of a practical question. So I'll just read it to you. Is there something that an employer should offer on a regular basis to their employees to mitigate mental health issues? Things like monthly meetings to talk about mental health and other matters, maybe lunches or help lunches or other things. I am a new leader at my workplace, and I would like to mitigate any mental health issues as best as possible. Might be harder to do than we want, but let's start with you, Paula. What do you think are some practical things an employer who cares can do?
One of the things that worked really very well and made a huge difference is senior leaders actually showing empathy to their people. We were going through a difficult time at the beginning of the pandemic, but difficult times are not going to go away once this pandemic settles down. So, just talking about, the environment that we're all living in, the challenges that we have as a business, but not only in terms of the numbers and the targets and things, but the impact on people, having them know that you've got their back and that it's okay to get support and you're expecting people to support each other as well. So just that empathy from a leadership point of view, I don't think you can get too much of that because situations evolve, but the empathy also always is strong. I think reminding people of the support and services that are available also is something on an ongoing basis because people forget. Like if you even look at how marketing is done, if you see a commercial once, you haven't seen it at all. It's going to have no impact on your behavior unless it hits you right at the moment where you need that wrench. Then you might remember it. But unless you hear things on a repetitive basis, particularly, if you're not in crisis, which we don't want people to be, then it's sand to the wind. So have that kind of health marketing approach, I think, is another piece. And continuing to invest in your managers. I think one of the other speakers mentioned that as well, because the manager's role in terms of flexibility and communication and really the work environment, it can't be replicated by any other role.
Very helpful. So empathy is really to some degree about trust, feeling that you can trust your employer. Shauna, you want to build on that?
Yeah, I think in addition to what Paula just said, I think just having resources available, whether it is, if your organization is one that is prone to doing things like webinars or lunches, I think that's great. We offer all kinds of sessions like that to our employees where we either look at our data and say what kinds of topics are our employees really calling in, or what types of things are going on in the world today that are very relevant or maybe are a little bit sensitive that we think are very that are potentially on the minds of our employees that we think it's important to discuss, and have our leaders come in and kick off these topics and have very real discussions about them and bring in experts. And what I think has become really great over the pandemic is the availability to get really amazing leaders and pioneers in all kinds of industries, whether it's astronauts or psychologists or doctors, et cetera, to really come in and talk very vulnerably about their own experience goes so well with an employee base. To hear someone who is so well known or marked to say, yes, this is something I struggle with too, goes such a long way within an employee base. So I would encourage, if that's something that resonates within an organization, to consider that type of approach as well.
It sounds like webinars like the one we're holding today are a good thing.
Yes.
More information is better. So I'm happy to hear that. Irene, you want to finish us off on this and then we'll go to the next topic?
Yeah, I fully agree with everything that's said. And maybe what I'll do just to add on to that is add some small tactical things I think that you can do every day as a manager. Because this person who asked said that they're a new manager and they're looking for ways on how they can manage it. So I would say if you have huddles or, daily team meetings or, huddles or weekly or whatever, add in an agenda item, top one, that says it's a health check, and you just openly talk about how you're doing and get people to talk if they want to, not force them, but get them to talk about it. And if they hear you talking about how you're doing, they will, that's how you build that trust, that empathy and vulnerability, and then they will open up. I would say, as a manager, know what resources are available, and make sure that if somebody comes to you, you have that available right away, and know where to point them. And the other thing I would say is, have some fun stuff in your meetings. We start off, typically in my team meetings, we start off with like, a team building exercise, not small, but like it might be something simple as, what do you like to do on your vacations, and just get everybody's perspective on what do they like to do, and it gets people sort of talking just in general. So those are some of the tactical things I would think of, to kind of go along with everything else that was said.
For that, Irene, I'll start with you on the next question. And there's a theme to this next question, but I'm going to add to it a question from the audience. So there's quite a bit of information, but I think the theme underlying it is fairly straightforward.
Okay.
So the question is, do people today generally understand and accept that mental health support is a normal and necessary part of personal wellness? Do employers get it? That just as anyone can get physically sick, so can anyone experience a mental health issue and need support? And Irene, I'm just going to add to that a question from the audience, which is sort of on this theme as well. How can employers be more sympathetic to the mental health challenges faced by employees? Can you touch on this from both what an employer can do and what an employee can do? So Irene, I know it's a big question, a lot in there, but offer us your expertise on this. How would you tackle that question?
Oh, okay. It's a loaded one, so it'll be good because I've got two other people here that are experts and probably can add on quite a bit. So I'll start off like prior to the pandemic. As you said, we know that mental health was a huge issue, and it has snowballed really. Many organizations, we did a survey, and many organizations said that they would be, prior to the pandemic, would be investing in workplace mental health. And this ranges from small employers to large employers. However, the stigma still exists. So it's really about creating some of the things we've already talked about, creating that safe environment, getting managers to really know how to manage employee mental health. And some employers are coming to us for solutions when they see the increase in absence and disability claims, and others are being more proactive. And I would say being proactive, knowing that, you're hearing us all talk about the fact that we expect that it's going to not get better, it may even get worse. So we have to be prepared. So be prepared, look at, developing a mental health strategy. We have a plan sponsor mental health toolkit that's available free to all. Would encourage everyone to go and see that on sunlife.ca/mental health. And it really does provide a guided approach on how to develop a mental health strategy within the workplace and how to start off. I mean, it's very overwhelming when you're looking to start that off, especially if you look at the national standard. It's a huge document. It's wonderful, but it can be overwhelming. So really taking those small steps to start building out how you're going to deal with mental health. And I'll stop there. And
that's very helpful. Shauna?
Yes, thank you. So I want to comment on two things. One, so like we like our colleagues at Sun Life, we took a pretty big stand on mental health several years ago and offered all of our employees in Canada and every one of their family members $10,000 every year towards mental health. And a lot of we got a lot of questions around it, and what happens? Are people going to use it? What's going to happen with your disability? Do you have a lot of disability claims related to mental health? And what we have seen definitively is that our disability claims have ultimately gone down. And while we might have had an increase in incidence, our duration has gone down significantly. So I think there is some positives that can come in with this investment. And so I, again, throw that invitation or challenge out to everyone that there has to be an offering to mental health, a specific offering towards mental health. I think younger generations, we're seeing, I reflect that there was a point in time when the millennials entered the workforce and everyone thought their preferences were so different than previous generations we've seen. But the reality is that millennials and younger make now 60% of our workforce. So they're more open to mental health. They're more willing to talk about mental health and seek mental health. And so it's really important that we address it, that we have solutions in place for them, and that we openly talk about it and have lots in place.
Thank you, Shauna. Paula?
Yeah, I'd say a couple of things. So again, adding on to everything that had been said before, I do think that there's some basic knowledge that people lack in terms of their mental health. We didn't grow up learning about that. I mean, it's only recently in schools that they're talking about that. The level of myth that has been in our society wraps around the world twice, and we can't just assume that because we are more open to talking about it, that people have access to the right kind of information to take care of themselves. I mean, there's still some thought that grit, it looks the same as resilience, and it doesn't. They're two very different things. We have wonderful use and recognition of the importance of meditation, but we have very little understanding about how important it is just to have a variety of experiences in our lives. Not just be stuck on work and then meditate, but have social experiences, have accomplishments that are outside of work, that just allow us to have a balanced diet to our brains, so we're not getting fatigued by having a focus in one area. And I can't even summarize all of the myths and the areas of opportunity when we get into the area of mental illness. So I think employers really have an opportunity to be a conduit to facts. And that's helpful because when people have knowledge, it really does lift stigma. It really does lift fear of help. It really does, move people in an active role as opposed to a passive role. And I recall one of the questions was around, what do you do if you see somebody struggling? How do you show, I think the word was sympathy. And I would say, it's not so much sympathy, but people have challenges of all sorts. And in all challenges, whether it's a childcare challenge, a health challenge, a work challenge, you want to make sure that you show that you care about that person, how they're doing, their well-being, you're not judging them, and that you're there as a support to a positive next step. So, if a manager, for example, sees somebody's behavior change, or somebody comes to them and they're struggling, showing that they care, asking if there's anything that can be helpful in terms of the work situation, just being flexible and with an adult-to-adult conversation around what needs to happen or what can happen to make that person more successful. And giving them information around what's available in terms of benefits. It's different than sympathy, which is hierarchical. I am sorry for you. It's an adult, caring, problem-solving approach without judgment, which I've never seen that go badly when it's authentic.
I think
that's really interesting. Please go ahead, Shauna.
Yeah. So, and I think, another thing I would just add, as an employer, one of the things we're often challenged with as we're talking about our benefits in the corporate space is prove to me this is a benefit we need. Let's look at our claims data. Let's look at our experience and prove to me that this is something we need to invest in. Show me the data, right? We always say that, show me the data. Finance wants to see the data. But we're in a reality, particularly depending on how some of our plans in Canada are designed, that we're not going to have the data. And that's scarier than having the data, because it is very feasible that depending on how the plans are designed, that our Canadians are not getting access to the care that they need. So there's a real important need to kind of develop what they would call in analytics, like a data quilt, if you will, that really weaves together data from a whole wealth of various areas. And some of it could be internal data, some of it could be marketplace data, and data from your insurance partners that really just says, let me, to my C-suite, let me build this story for you of why this lack of data that we're potentially seeing within our own population is of grave concern, and why we really need to address it. Because whether, if you're not seeing an abundance of mental health claims within your population, it's not for lack of need, and it still needs to be addressed.
Thank you for that. This panel has just been fantastic, and the hour has just flown by. We have under 10 minutes left, and we still have quite a bit to cover. So I'm going to jump right away into poll number 2, because I do want to hear from the audience in terms of that question. So let me read it out. To what degree do you feel that mental health issues and challenges are becoming better understood and accepted in the workplace today as compared to 3 years ago? And it can be much less understood and accepted, somewhat less understood and accepted, no change, or somewhat better understood and accepted, or much better understood and accepted. I'm going to launch it. Again, this is anonymous. It is aggregated. No one will know your personal answer. Please tell us your thoughts, and in a few moments, I'll share it with our panelists and ask if they have any comments. And as folks answer, I'm also going to sort of prep the next question that I'm going to ask, and you can weave in the response to this poll at the same time. So it's about this issue of stigma. Some employees are concerned that if they openly acknowledge that they are experiencing a mental health issue, they might face a stigma in their career. If not immediately, then perhaps in terms of being given more responsibility or being promoted. Is that still an issue in today's workplaces? And related to that is a question from the audience, and so I'll read that as well. It's connected. Can the panel give any advice on how to discuss requesting a leave with your manager to improve personal mental health without facing stigma and career sabotage? So very interesting questions, very interesting topic. Let's end the poll and take a quick look at it. Very good news for employers, very good news for you as professionals in terms of what you're promoting. It sounds like most people feel that the decision makers are listening to your wise advice and that things are changing. And 88% are saying things are either better understood or much better understood. I'm encouraged by that. I trust and hope that you are as well. So please offer any thoughts on that, as well as this whole question about stigma and whether that still exists despite all your best efforts. Paula, let's start with you.
Yeah, well, stigma does exist. I think we've moved in a positive direction, but I think we would be foolhardy to think that it doesn't exist and it doesn't shape people's behavior. It prevents people from getting care. It prevents people from actually recovering appropriately, because it adds an extra strain on top of the issue that they have themselves. Like the energy that it takes to hide or fear is tremendous. And I do think that it will take a little while, but we're in the right direction. If you as an individual, and I'm going to give you two responses, because the reality of the situation is that I can't tell somebody that there's no stigma. I mean, that's not true. I hope it not to be. And even in situations where it is true, even in organizations and even with relationships where there really isn't any stigma, I don't want to force people to feel in any way that they have to reveal health information for whatever reason, whether it's a mental health issue or whether it's your diabetes or anything else, your health information is your personal information and you have control over how you handle it. So if you're speaking to your employer, if you're speaking to your manager, if you have a level of comfort, if you feel safe, if that environment has been created, then absolutely, feel free to share and then work out what your next step is. If not, there is really a slightly artificial separation of mental health and physical health because it's all health. Right? And if you have a health issue, talk about the fact that you might not be able to do the tasks of your job in the same way. You might need accommodation, you might need support, you might need flexibility, you might have had a recommendation of time off because of a health issue. You don't necessarily need to go deep into why. And in particular, a lot of the situations and symptoms people experience with mental health issues like fatigue, concentration issues, those are also things that come up when you have disease process in a number of different areas and pain. That impacts your concentration and your fatigue as well. So you can talk about what you feel comfortable talking about, but you can also talk about it as an overall health issue, because I see at some point we will get to the point in our society where we don't see the big distinction between mental and physical health. We see an overall holistic individual, there's a health issue, and it really gets down to the nitty-gritty of what kind of treatment or support you need that makes you pinpoint diagnoses. But overall, talk about what you need, what you can and can't do, and then try to negotiate some modification to be at work successfully if you can, and understand how your leave would work if that's truly necessary.
Thank you, Paula. Irene, do you want to jump in on this?
I totally agree with Paula. I think if like she said, you don't need to discuss what your health issue is, and if you need time off, and you've talked with your physician or specialist or whomever, you talk to your employer about what your needs are in terms of the needs, not the specific health issues. So I agree with Paula there.
Thank you. Shauna?
Yeah, I'll echo and just say that's why the resources are there. So whether it's working with your employee family assistance program or any of the multiple options, that's what they're there for. So if you're have that established relationship and you're curious or nervous about having that conversation, they'll help you with how to work through it and how to approach it. So, my 2 cents would be, make sure you have that established clinical relationship in whichever form makes the most sense for you. And they'll guide you so that you can share the appropriate level and the right level of information to make sure you get the care you need.
Thank you. And let's have our last poll question just to finish things off. If you were to experience a mental health issue in the future, how willing would you be to share your situation with your employer and take some time off to obtain professional therapy? Very unwilling, somewhat unwilling, neutral, somewhat willing, or very willing. Let's see whether people are at the stage of comfort where they would be comfortable talking to this about with their employer. So we'll just wait a few moments. So what we're seeing is that a majority of people are saying they would be willing to talk to their employer, 46% and 14%. But there's still a very significant portion, nearly 35% of people who wouldn't want to do that. So there's still a third of the workforce, based on this obviously unscientific panel, that would not be willing to talk about this, even if it's something that was an issue for them. So let me wrap it up by asking you if you have any final thoughts on this poll result, and just any final words of wisdom from the three of you. Shauna, you want to start us off?
So thank you, everyone, for listening today. And my advice would just say, be brave, be bold, help your employees, and fight for your employees. That's the best that we can do, and make sure they get the help and support that they need.
Thank you, Shauna. Irene?
I would, some final thoughts, and again, thank you. And I would say, you know, just to go with what Shauna was saying, you know, battle the stigma first. You know, if you can at least get people to open up and be vulnerable yourself with your employees, you know, that is the first step.
Glenn, final word to you, Paula.
I would just say focus. You know, I think at this point in time, as we spoke about at the very beginning, the need is higher, genuinely higher. And we still have systems and attitudes and things that were built at times that where it really didn't even come close to being able to meet the need. It actually was counter to what we've always needed. We've underinvested in mental health from a number of different points of view. So I think for the time being, it really does have to be a priority. And I think it'll be well worth it in terms of our culture as well as our collective health if we do have that focus.
Paula, you have been just a wonderful panel. All of us I know are very grateful to you. Your employers are very lucky to have you advocating for these critically important issues. And at CAFE, we just want to say thank you for taking time out of your very busy schedules for sharing your expertise, knowledge with us. It's really something we are grateful for. And to all the attendees today, thank you as well for taking time out of your schedules to listen to this important topic. And have a great rest of your afternoon, everyone. Thank you so much, panel.
Yeah.
Take care.
Bye-bye.